All right, so it is noon, so let's go ahead and get started. Welcome everybody to what is going to be actually the last of the FAFP webinar series. Certainly appreciate the turnout, and again, we'd like to thank all the members and the sponsors for your ongoing support of FAFP. So just to start off with some housekeeping items, please keep your video and audio off throughout the duration of today's program. We'll ask Joe to answer questions from the audience at the end of this presentation, and we will have a team of volunteers who will monitor the chat box and facilitate your questions with Joe. So please do enter questions you have directly in the chat box. We will also be recording the program to post on FAFP.net, so please check that out for this and all the previous presentations and other information about upcoming events. Today our speaker is Joe Baumert, and Joe, I get to go a little bit off script because I knew Joe back before he became an internationally recognized expert in allergens. We actually shared an office when we were both in graduate school, and it was actually an allergic reaction that caused Joe to change directions into his current field, and he's been tremendously successful since that time. Joe is currently a professor in the Department of Food Science and Technology and is the director of the Food Allergy Research Program at the University of Nebraska-Lincoln. Dr. Baumert maintains an active national and international research and extension program. His research interests include identification and characterization of novel food allergens, development and improvement of analytical methods for detection of allergenic proteins, and development of quantitative risk assessment models for food allergens. Extension activities include outreach and training for food industry on allergen control solutions and processing plant sanitation, expert consultation to minimize the risk of allergen cross-contact, and quantitative risk assessment consultation. And with that, Joe, I'll hand it over to you.
All right. Well, thank you, Jason. And again, thank you for the opportunity to be here today. From what I understand is the last in the series for your webinars. Again, appreciate the opportunity to give this presentation on what is the journey of sesame allergen, sesame inclusion in priority food allergen status. Today we'll talk about the process and really that journey from petition on through to legislation and that FASTER Act. So again, with that, before I start, I want to go into a little bit of some of the general aspects of food allergy, and so we're on the same page about some of the different priorities of where we're at with food allergy and some of the information we have before venturing in specifically to sesame. So again, with food allergies, we see a prevalence that has been reported, various publications over the years in which we see perhaps overall around 3 to 4% of the US population being or having food allergies, in which we see probably around 4 to 8% of infants and children having food allergies, and about 1 to 2% of adults having food allergies. So you see that difference between children and adults. We often see development of some tolerance with certain food allergens that are predominant in infants and young children, such as milk and egg allergy, that again by adulthood often is tolerated. But we do see others such as peanut, tree nuts that if developed in infants and children tend to have that lifelong affliction, providing against that 1 to 2% of adults being allergic to various sources. With the severity component, we do see food allergies being anywhere from mild type of reactions onto moderate or even severe, and potentially fatal type responses. So we do see a diversity of different reactivity, but with any food allergen, we have seen the opportunity to have a diversity of different reactions, and it's fairly rare, but occasionally we do see those fatal type reactions. The important part here is that these reactions are preventable with good opportunities for prevention and accurate label reading, accurate avoidance diets, and so forth. So Again, food allergies are preventable, but certainly consumers need access to very transparent information so that they can make decisions on their avoidance diets. There has been a number of studies, or one primary study conducted by Dr. Ruchi Gupta's group at Northwestern that has looked at the financial burden of food allergies. And so we do see that food allergies constitutes a significant financial impact to the US society. In this case, the estimate was around $24.8 billion that's of expenditures annually by families that have children with food allergies. And that accounts for roughly an estimate of around $5,000 per family with a food allergic child. And things such as lost wages for family members that may stay home as they may not put their child in daycare, additional cost in food, additional cost in healthcare, all of those elements contribute to some of these financial burden that we see that contributes to that $24.8 billion. Certainly, we do see that allergens, food allergies do have, can be quite sensitive, and sensitivity, if we look at what we know about thresholds or eliciting doses in the population of food allergic individuals, we know that there's small amounts that can trigger allergic reactions in some individuals in the population. So low milligram amounts of protein from that allergenic source, or equivalent to low part per million concentrations in that food, certainly can trigger reactions in some of the more sensitive individuals. Interestingly, when we look at some of the threshold data available, we see quite a diversity of individuals that have reactive doses in the overall population. So some will react to very small amounts, sub-milligram doses of protein from that allergenic source, where there's others that may need several milligrams to almost gram quantities before they reach a dose that they would react at. So quite unique in the capacity of food allergies and those reactive doses. And each individual has a different level of sensitivity that could contribute to their reaction. Now, I mentioned avoidance diets as being the primary way that food allergic individuals currently manage their safety from different allergenic sources. So with that, again, there's diligent label reading and so forth. A lot of questions that are asked to ensure that they can identify if there's an opportunity for the allergen to be present, or perhaps an opportunity for cross contact in either in prepackaged food products, in food service and catering type opportunities as well. There are treatments that are coming on board, such as one that was recently approved this year by the FDA for A-Immune, which is a treatment specifically for peanut allergy. But otherwise, currently there's several more research-oriented trials going on for various allergens as treatment. We do see some things in the realm of prevention as well. There's been some studies that have looked at the opportunity to introduce some of these allergenic sources early in the diet to help drive prevention or tolerance to allergenic food sources. And we'll touch upon that a little bit later as well. When we look at food allergies, of course, we often focus here in the US on what has been coined as the Big 8, and you can see those allergenic sources of food highlighted here. With those, we often see that they have similar properties within these allergenic foods, in which we, of course, are focused on those naturally occurring proteins within the foods as they're associated with IgE-mediated reactions. Many have some properties that I've listed here that probably make them more akin to sensitization and development of allergic response to those allergenic proteins. So they have properties such as resistance to heat. So again, you might denature them a little bit, but that doesn't necessarily render them non-allergenic. So you'll see reactivity to heat processed products and things that are typically consumed unless you have highly extensive heat processing, probably to the point of almost getting to ashing type conditions, that you might start to see a drop off in some of those allergenic properties. They're resistant to proteolysis. So again, different unit operations can make them still be largely intact and reactive. And certainly that means that when it consumed and brought into our bodies, there's some degradation of these proteins in the body, but by and large, the large peptides that may remain can be reactive, which can trigger those allergic response. Again, resistant to extremes in pH, so gastric conditions can also have limited effect on the stability of some of these allergenic proteins. And then we see that dependent upon source, there's usually several of the major proteins that are the allergens in these different food products. And there can be a limited number or even quite a few of the proteins from the individual allergenic sources that can cause reactions. And I'll use peanut as an example today, where there's approximately 12 to 14 characterized allergens within peanut. So there's quite a diversity of different proteins. Again, usually the predominant proteins from the allergenic source that are part of those allergens. Now, I focused on the big 8 allergens, but in reality, we see that anything with protein could cause a reaction or could have the propensity to cause sensitization. And there was a study published a number of years ago, which was just a review of data and published studies where they've looked at which or how many allergenic foods could cause or have been reported to cause food allergies. And at that time, well over 160 foods were documented to have caused a food allergy. Now, with that, we don't see high prevalence. Sometimes severity and potency are different because they could be just associated, for example, with oral allergy symptoms. So something like cross-reactivity, if you're pollen allergic and reactive to ragweed, you might have oral allergy symptoms associated when eating melon, such as a watermelon. So again, you can see that would increase prevalence, but again, potency and severity are limited in certain capacities. So that wouldn't raise that to probably that level of priority allergen or major allergen status like we see with the big 8 allergens. Again, treatment, there are limited options at the moment for treatment across all food allergens, certainly. So a specific avoidance diets are those critical aspects of what we're looking at for consumers as they go out to the marketplace or to a restaurant elsewhere to assure their safety. Speaking specifically to packaged food products, allergic consumers do rely on labeling to avoid allergens. So they're looking at labeling that has followed those regulations intended to provide that clear, accurate, and complete information so they can clearly identify that the allergenic component may be included in the product formulation. Now, the legislation here in the US focused on clear labeling is the Food Allergen Labeling and Consumer Protection Act of 2004, affectionately called FAFP. Again, this was an act that was passed by Congress back in 2004, which provided definition here in the US for those major allergenic sources, which are the big 8 allergens in this context. So these would be the ones that have traditionally been labeled and handled as allergens within facilities and so forth. Internationally, we see that there are differences in regional regulations of what is considered a major allergen. So we might see differences in the different labeling dependent upon region and some of the prevalence and other factors brought into the consideration for allergen inclusion in their labeling laws. So with FAFP, again, it's the intentional addition of the major food allergen or ingredient derived from that major food allergen that would trigger that need to be declared on that label. And then other regulatory agencies such as USDA, FSIS, while they don't follow the mandates of the Federal Food, Drug, and Cosmetic Act where FAFP lies, they have largely followed suit with what FDA has recommended for the priority allergen list. Again, international priority allergens can be different dependent upon those different consumption patterns. So you might see differences in prevalence, and that might trigger the addition of that particular allergenic source on their list. And a good example might be buckwheat, where we see buckwheat allergy being more prevalent in a country such as Japan. So we see that as an identified priority allergen. There's different processes used for determining the criteria that would merit a priority allergen. So we don't see largely international harmonization across different regulatory agencies or countries on how they may adopt different priority allergens. Many countries do follow the Codex standards, which have identified priority allergens. And back in 1995 and adopted in 1999, there were Codex General Standards for labeling of prepackaged food allergens, in which they reviewed and identified those priority allergens they would consider for recommendation of labeling in various jurisdictions. So with that list had things such as cereals containing gluten, crustacea, eggs, fish, peanut, soybean milk, tree nuts, and tree nuts were not well defined, and then sulfites as a compound that causes adverse response, but not necessarily an IgE mediated allergy per se. And I provide a link to our website. We try to track a lot of the different regional regulations for food allergen labeling. So it is a good resource that you can take a look at to see which countries around the world have different allergen regulations for their collective regulation or a specific allergen if you want to search for that as well. I do want to highlight some very recent activity that's been organized by FAO and WHO, in which they convened an ad hoc joint expert consultation, which is focused on a broad spectrum of risk assessment of food allergens. And part one of this expert consultation was tasked with the review of and validation of Codex priority allergen list. So as a member of the panel, I can say that we went through a very rigorous process to look through and review all available data using the criteria of prevalence, potency, and severity as a primer for what we would consider and recommend as priority allergens. So with that, again, I provide the link to the summary report that is now being forwarded on to Codex for consideration. And I think it'd be a worthwhile read to take a look at some of the activities and some of the recommendations that the committee brought forward. Particularly for today, I will mention that sesame was recommended as a priority allergen based off of, again, international aspects of prevalence, potency, and severity. So that would be an addition, and it would harmonize, again, with some of the individual regulations, such as Canada and the EU that already have sesame as a priority allergen. I provide others on here as well, where we see cereals containing gluten, crustacea, eggs, fish, milk, peanuts. In this case, specific tree nuts were identified and reviewed. Now, in addition to this, there were opportunities where we made recommendation for perhaps regional consideration. And again, buckwheat's a good example where regional consideration in countries like Japan might be appropriate based on the prevalence and potency severity that they see for that particular allergen. So let's move on to sesame, which is our task for today, and walking through that journey. As we see, again, internationally, sesame has been considered or has been recommended now as a priority allergen on a number of fronts. So with sesame, again, we have different types or varieties of sesame seed. So we see yellow, white, red, brown, and black. It does have a fairly decent amount of protein, roughly 20 to 25% protein in the sesame seed. So again, making it a good source of protein, as well as giving it enough protein for opportunities to be for sensitization as well. With that, looking specifically at sesame allergy, we do see that, of course, sesame does cause food allergies. The prevalence is lower, as you'll see, comparatively to some of the priority allergens. We know that some of the allergic reactions can be quite severe associated with sesame, but that can be said with all of the priority allergens. There are reported severe reactions or fatalities associated with all of the priority allergens that we see on those lists. So that, again, sesame would align in that capacity as well. And prevalence of sesame, again, varies around the world. And if we look internationally, we'll see higher prevalence reported in countries such as the Middle East, Israel, Australia as well. Lower prevalence, but still prevalence that aligns with some of the priority allergens here in North America, as well as Europe. Again, potency, if I look at that from the definition of where we see those reactive doses from clinical studies and those threshold studies, the potency of sesame would broadly be similar to what we see with other seeds and nuts, for example. So what we see is it aligns from a modeling perspective very similar to peanut and some of the tree nuts, even milk and egg it would align with as well. We do see that some of those proteins within sesame that are characterized allergens are similar in the protein families that we have with other seed storage proteins or nuts that are characterized as allergens. So we often talk about the 2S albumins, the 11S, 7S, so those type of broad protein families, we see some of these allergens residing. That doesn't necessarily mean that we see cross-reactivity across sesame to, say, for example, peanut or tree nuts in a broad perspective. Occasionally, we might see co-sensitization or rare opportunities for cross-reactivity. So from an international status, we do see sesame labeled already as a requirement in the allergen labeling laws in Canada, in the EU, Taiwan, some of the Gulf standardization organization states as well, and Australia and New Zealand. I haven't added US here yet, although we have seen that the legislation is passed, and we'll talk about that here in this presentation as well. So in 2023, officially sesame will be added. Again, we do see some reported reactions that can be quite severe and fatalities, and I highlight one here that was a fatality, unfortunately, associated with a sesame allergic child, 15-year-old teenager in this case, that had consumed a product at London Heathrow Airport, and unfortunately it wasn't labeled well, had sesame in it, and she went into cardiac arrest on a flight from England to France. And again, that fatal type reaction certainly is it's rare, but it certainly can happen. And it highlighted the potential severity of sesame allergy. Again, this was in 2016. You'll see that align with several things that we see with some of the march towards including sesame allergy or sesame as an allergenic source here in the US. So again, very sad case, as this was preventable with good labeling processes. In the US, we have a reliance and use of primarily self-reported or telephone type surveys that are used for evaluation of prevalence. And while these aren't perfect, they're a good snapshot of what we have for food allergies. And the group at Northwestern has conducted several of these studies in recent years, both from the pediatric population, infants, children, as well as those of another study in 2019 for adults, looking at the prevalence of food allergies and trying to normalize that from the self-reported part to confirmed diagnosis and making adjustments in the prevalence estimates. We do see a bit higher prevalence reported in these studies overall, in which we would see overall food allergy in children being about 7, almost 8%, whereas adults, it would be an indication of around 10 to almost 11%, which is substantially higher than previous studies had reported. So specifically, if we look at sesame, we see that the prevalence is estimated to be about 0.2% in the population, both in children and adults. We see that kind of hovering in the area where we see with prevalence of maybe soy, wheat, as well as pistachio, some of the tree nuts as well. I highlight molluscan shellfish, which we don't have as a priority allergen in the US, but that's one where we see approximately 1, perhaps even 2% in the adult population. So again, this kind of gives you a perspective of where we're at for overall food allergy in the US. Sesames were not labeled here in the US from the perspective of a major allergenic food source. So it was not included in FAFP and what was originally passed by Congress in 2004. But I want to note that sesame seeds, as whole sesame seeds, as an ingredient already must be declared on the label due to general provisions of labeling. So if it's an ingredient, it would be included. Although there are some areas where you see sesame used not as a whole seed, but as sesame flour or oils, for example, used in things such as spice and flavor. So there are other forms that may not always be declared when encompassed in spices or flavor. So with that, again, there would be that requirement for source labeling, I should say, not even allergen labeling in these instances. There are some others where consumers have been confused with sesame ingredients, such as tahini, where it's an ingredient but not always labeled as containing sesame. So getting into some of the activity around sesame and our process towards getting it to priority allergen status. One of the first activities was in 2014, in which there was a citizens petition that was submitted to the FDA, and that was led by the Center for Science in the Public Interest, CSPI, but signed by the primary consumer group, consumer advocacy group, FAIR, as well as a number of prominent allergists here in the US. And the request was for FDA to issue a rule requiring sesame to be regulated similarly to other major food allergens. And you can take a look at that particular docket as well. In this case, again, the request was to include it as a priority allergen, but FDA didn't have the capacity to provide to amend FAFP to include sesame. That was again an act by Congress that needed to ensue to make those changes. In 2018, there was a request for information from the FDA on sesame as an allergen in foods. So they were looking at various activities around clinical aspects as well as usage of sesame in food products. And that again was published in October of 2018 and open to comment. So there was around 4,800 comments submitted from consumers and other stakeholders with information that the FDA had requested at the time. More recent activity has been focused on some voluntary guidance around sesame, as well as the FASTER Act, and we'll talk in detail about the FASTER Act. But I do want to highlight the voluntary labeling guidance that was issued for public comment by the FDA as well. Both of these are currently out in I think there sometimes is a bit of confusion on this as well. So FDA had issued draft guidance entitled Voluntary Disclosure of Sesame as an Allergen. Again, guidance for industry in this instance, which was published on November 11th of 2020. And again, I provided the docket and the direct link for your review if you'd like to look for more information on this. The guidance was, again, giving current views on sesame as an allergen and providing recommendations to voluntarily disclose sesame where such disclosure is not currently required. So again, focused on those opportunities for spices or flavors primarily. So in that, there was a discussion around developing a process for designating priority food allergens. Again, discussion on the limitation FDA had currently or does have in regards to adding it to the priority allergen list or amending FAFP, but they provided some guidance around things such as additional allergen controls, including labeling. Again, while the evaluation process was in development, again, thinking more towards FASTER Act, they made comment here on providing voluntary recommendations to manufacturers regarding best practices for sesame labeling. So while it wasn't, this document suggested to become a priority allergen, again, they were trying to identify ways in which they could highlight sesame in the ingredient statement where it would not normally be included. So they also talked about some of the data that was identified from the 2018 call. And with that, part of the call was to look for information and of allergic reactions associated with sesame allergy. So FDA had requested at the time to upload any information on reactions into their CARE system for adverse event reporting. And with that, they received around 500 individual reports of adverse events associated with unintended consumption of sesame. Taking a look at where some of those reactions occurred, again, it was most frequently reported from things such as hummus, tahini, hafal, things that have sesame as a primary ingredient, but not always readily recognized by consumers. But there were approximately a quarter of those reported reactions in which sesame was undeclared or not readily distinguishable. So the voluntary guidance and the recommendations in this draft guidance were to, again, identify in parenthetical or other ways in which you could highlight sesame, specifically in those areas where it wouldn't be required through general labeling to include sesame on the ingredient statement. So including your spice and then including parenthetically that it contains sesame. So again, trying to call out the opportunity for sesame to be present in these different products. Again, they had also recommended that if the term is used for a food that is or contains sesame, such as tahini, that wouldn't regularly have sesame included, the recommendation was to parenthetically include sesame for more transparency for consumers to identify sesame more readily. The draft guidance did not specify guidance on contain statements. Again, the contain statements traditionally have been reserved for those priority allergens, so those ones listed as part of the Food Allergen Labeling Consumer Protection Act. So they, in this case, without sesame being part of that primary group or priority allergen group, it would not be appropriate necessarily to put sesame in a contained statement. However, as we see with the FASTER Act, that will change as well. Also did not include guidance on preventive controls, just some general discussion around allergen controls, but not how one would handle sesame perhaps in a preventive control, because again, it wasn't elevated to the level of a priority allergen. So the comment period was extended through February 25th of this year. As of yesterday, I did take a look, and there were about 5,100 comments that were received, and a few additional ones trickle in occasionally. Most of the comments in my peripheral view of them or cursory review would be from consumers that have commented that there needs to be more done to have clear labeling of sesame and management of sesame as an allergen. So again, elevation beyond the voluntary process. Again, timeline for this guidance document, I think, is uncertain at the moment. And now that we have the FASTER Act, which I'll transition to here now, I think it'll be likely superseded by the mandates of the FASTER Act, of course. So the FASTER Act, for those that aren't familiar, it's an acronym for Food Allergy Safety, Treatment, Education, and Research Act of 2021. There's a number of different elements associated with the FASTER Act, but the primary one we're focused on today would be the amendment of FAFP, which again amends the Federal Food, Drug, and Cosmetic Act to include sesame along with the original big 8 allergens. So we would now have the 9th allergenic source added to FAFP. Again, there were some additional provisions included that we'll touch upon as well, but there's provisions to establish or develop mechanisms for amending the definition of major allergens or priority allergens, and requirements for food allergen prevalence assessment as well. So trying to gain more accurate data or additional data on the prevalence of food allergy. So again, if you look specifically at the Code of Federal Regulations, where we see FAFP lies, we would have the term major food allergy considered to include everything up to soybeans. Now with the FASTER Act being passed, we see the addition of, or soon to be the addition of sesame as the 9th allergen in this case as well. So again, sesame, for those using sesame as an ingredient, it would need to follow the FAFP mandates for labeling requirements. So again, mandatory declaration using the process either in the ingredient statement to declare in all instances where sesame would be used, or in a contained statement. So one could say contains sesame. Just a note for everyone's reminder that if a contained statement is used, it needs to have all of the major priority allergens included in that statement that are in the formulation. So you would have to say contains sesame, but also if the product contains milk and wheat, those would need to be included in that contained statement as well. With the passing of FASTER Act, of course, there would be amendments to FSMA and to allergen controls, and some of the processes we would see with the preventive controls for human food rule, in which it did identify food allergens and those major food allergens per the Federal Food, Drug, and Cosmetic Act. So you would see the need to follow suit with sesame as included in your risk evaluation for all of the allergenic sources used in the facility. So it would be considered a food allergen, followed context of FSMA. So in the intervening 2 years before January 1, 2023, not only do we need to work on getting the labeling process put in place, but manufacturers need to start to evaluate and do their hazard assessments and identify if sesame is used, where some of those preventive controls as well as GMPs would be put in place to manage sesame as an allergen as well. In addition, the last parts of the FASTER Act do want to highlight, because I think there's some important elements to keep a close eye on as they develop in the intervening months to years. So part of the FASTER Act and some of the provisions would require ongoing federal activities related to the evaluation of prevalence and severity. So trying to collect more data, including a gap identification for where we need additional resources or research, development of effective food allergy diagnostics and evaluation of food allergy prevention, and where those prevention as well as treatments are being effective and so forth would be important processes that would require the Secretary of Health and Human Services to provide reports back to Congress on this in this capacity. Again, there were specific recommendations and strategies to expand or enhance or improve different activities. These were largely items that were highlighted in the National Academy's report. I'll give a reference to here at the end of the presentation. But again, looking at strategies to improve collection of prevalence data and the accuracy of the data. Again, looking at overcoming those gaps in surveillance and detection of data collection. But importantly, the one I want to highlight is development and implementation of a regulatory process and framework for future updates to the major allergenic list. So this provision is that opportunity to provide a scientific criteria for defining food allergens or allergenic ingredients that could potentially be listed as a priority or major food allergen. So identifying what that framework would be that would constitute inclusion of an additional allergen. So things such as prevalence, severity, as FAO, WHO expert consultation used, potency was also another element. So there will be opportunities for stakeholder engagement and comment. So again, I think this is one of the key areas to highlight and to provide that engagement, because I think there's, again, a need for that clear and transparent scientific process for review, as well as consideration of a new allergenic source to be listed as a priority allergen. So again, a lot of those elements were covered in this National Academy's report that was issued at the end of 2016 and put in print in 2017. This is a document free to download as a PDF. So again, provide you the link here to take a look. There were quite a few different topics that were covered, anywhere from prevalence all the way to management in various capacities in industry, retail, food service, and others. So I think there's a lot of relevant information around overall food allergy and allergy management. And finally, just as a summary, With the passing of the FASTER Act earlier this year, it would now require the inclusion of sesame as considered a major or priority allergen, similar to others also included in the Food Allergen Labeling Consumer Protection Act. So we do have a compliance date set, which there's January 1, 2023 date for compliance. And I know there's a lot of activity already with food industry that has been working on bringing their different allergen control programs as well as labeling programs into compliance at this point in time already. Again, that report on recommendations may have those long-term implications, so that stakeholder engagement and comment, I think, where those opportunities arise will be important. So with that, I appreciate your time today, and I will open up to any questions you might have.
Thank you so much. Yes, there are a couple here. So the first one is, are there any other allergens on the horizon that may be elevated to the status of a major food allergen?
Yeah, it's a great question, and I would say my crystal ball is a bit hazy there as well. I think that's why we need that framework that I talked about at the end here on what constitutes that, some of the aspects of inclusion into the priority list. So thinking about the prevalence, potency, severity would be important ones, again, that have been used internationally. And so having guessed on what would be next, again, there's, I would like to see what that scientific criteria would look like. Knowing what the FAO WHO process had looked at and reviewed, I wouldn't see any additional ones beyond what are currently on our list, in addition to sesame, that would be on the near-term horizon. Now, again, as we see more products going out to the marketplace that often have, higher protein, so very dense protein loads, some of the dynamics could change. So we might see opportunities for increase in prevalence to some of these high protein type food products. So again, we'd have to keep a close eye on some of that capacity as well. So I can't give a specific example at the moment that I would anticipate being on the horizon.
That's great. And the next question you've kind of touched on, I think, but how does that next allergen's prevalence compare to current data on sesame?
Can you repeat that one?
How does that next allergen's prevalence compare to current data on sesame? So I guess we might need to know what the next allergen would be before we could answer that. But
yeah. So again, I think there is a need for additional prevalence data and a bit more harmonized data. I point to some studies in Europe that had a more systematic approach to trying to evaluate the prevalence of different food allergens. I think that more systematic approach could be useful here in the US as well. So that's part of maybe where we need some additional research needs beyond the surveys and telephone calls or online type approaches that we've seen traditionally used. That might be enlightening to see the comparative differences at certain allergens. Now, if we look at sesame in comparison to some of the other priority allergens, again, we see lower prevalence comparatively to things like peanut, milk, and egg, but those are used in a lot of different products. So higher use equals perhaps higher probability of opportunity to become sensitized as well. So, again, I think it's beyond just prevalence that we need to focus on, and looking at potency and severity will be the other two key elements that also are important for evaluation of the next allergenic source.
thank you. The next question is, could you speak on some of the efforts to purposely expose young children to allergens like peanuts to stave off development of an allergy?
Yeah, another great question, and really one that has been, kind of a 180 in direction that we've seen. So just to give context and a bit of the historical practice, somewhere probably about 20 to 30 years ago, there was many of the pediatric associations had recommended the avoidance of different allergenic sources such as milk and egg and peanut, some of the tree nuts, for example, for a number of intervening months to perhaps even years of life in that infant, if there was a propensity for that infant to potentially develop food allergies. So that could mean something as simple as the parents have food allergies, or maybe the parents have seasonal allergies, so they're atopic, as we would call it. That might trigger the need for avoidance. There might be another sibling in the family that had food allergies, so that might also trigger the recommendation for avoidance. There was a nice observational study that triggered kind of this change in process that was conducted in the UK. And it was a couple of clinicians that noted where peanut allergy has a very low prevalence, about 0.1% of peanut allergy in Israel. Whereas in the UK, same in the US, we see peanut allergy in children being around maybe 1 to 2% of the population. So that triggered what's the critical difference? And that led to what we called the LEAP study, learning early about peanut, in which there was a systematic study in the UK looking at similar populations of children with the same genetic backgrounds that looked at avoidance, following that recommendation for avoidance for the first 5 years of life versus introduction early, around 4 to 6 months of age, where those children would receive peanuts consistently throughout the week over those 5 years. And what they found was a marked reduction in peanut allergy in those that had early introduction, pointing to the idea that early introduction and having consistent and somewhat quote unquote high doses of exposure provide tolerance when the immune system is developing. Whereas the avoidance approach, even though you might be avoiding oral consumption, if the food is in the environment, in the household, for example, there's still exposure. So such as dermal exposure or other routes, or maybe even small doses, but infrequent doses that are orally consumed. And they believe that these random or inconsistent exposures were leading to that development of food allergy or peanut allergy. So since then, there's been studies that have looked at milk and egg and some other allergenic sources, showing not quite as substantial as a peanut allergy and early introduction, but still showing some benefit for early introduction of allergens into the diet. So you're starting to see the recommendations change that have drawn back on the avoidance portion, and we're starting to see more allergists recommend that early introduction for to help hopefully drive tolerance in those individuals.
That's really interesting. The next question is, how relevant is a prevalence study versus potency study when it comes to determining a sesame allergen?
Yeah, I think, again, I think they go both hand in hand. Again, if we look at prevalence, just specifically and how many might have food allergy, we could have things such as I mentioned earlier, the ones that have, just trigger oral allergy syndrome because of the cross-reactivity with some pollen-induced effects. Now, if we brought that into the fold, the prevalence of that of pollen-associated allergy is quite high. So, that would bring in melons and other things. So if we only focused on prevalence, we would have quite the list, I think, of allergens considered major allergens. So it's a balance, I think, bringing in that element of the potency. So looking at comparatively what we know about reactive doses in the population comparatively to other known allergens, is an important part of the overall process. Now, certainly severity is also a important process and consideration as well. And again, if we bring about those three elements, things such as the oral allergy syndrome, pollen-induced type reactivity wouldn't meet the potency and severity type elements as well. So again, while the criteria hasn't been set, I think all three of those are critical components for consideration in the process.
Thank you. I was wondering if you have an opinion on removing coconut from the tree nut list.
Well, I have an opinion, but I think we're marked with, it is considered based on FDA guidance in response to FAFP back in 2006, where it was included in the list of what they would consider priority tree nut allergens. While it doesn't meet the true definition of a tree nut, it is included on that list. There are reports of reactions to coconut. Again, some of them can be moderate to severe type reactions. Prevalence, again, if we use that criteria, we don't often see a very high prevalence of coconut allergy as well. So again, I think we're faced with another avenue where if we wanted to have coconut removed, we would need to have a defined criteria by which we would have inclusion, or for that matter, exclusion of allergens from our list. And that's what we really need. Premising that it's not a tree nut, so it doesn't fit, has been discussed with FDA without any traction. So I think, again, we need to present other elements and really have this context of what is considered a priority allergen, and that transparency to help drive some of this decision making.
Thank you. That is all the questions at this time.
Okay. Well, thank you, Joe. And certainly we'd like to express our appreciation to all the sponsors that have helped carry us through, certainly the pandemic. This would be the last webinar. And so we're going to hopefully go back to some semblance of normal. And so next month is the International Association for Food Protection. So hopefully we will see you there. And in August, we are going to have our first face-to-face quarterly meeting, which is going to be hosted by Firehouse in Jacksonville, Florida. And so hopefully we'll get you some more details, and hopefully we will get to see you there. Again, check out our website, and that's where we can find a lot of information as well as all the previous recordings. And with that, thank you for attending, and hopefully we will see you soon.
Thanks, everyone.